guys, welcome to my channel. I am Seyma, an ASHA-certified audiologist and the author of Living with Tinnitus book. Today, we are going to talk about what is tinnitus, why we hate it so much, and what are some management strategies for tinnitus that caused by a hearing loss. Let's get started. Alright, let's talk about relationship between tinnitus and hearing loss. So the hearing loss is causing the tinnitus, and it is not the other way around. So it is not the tinnitus preventing you from hearing someone. It is the hearing loss causing the tinnitus. This is an example of an audiogram. Let's say this is a patient's audiogram. Patient has high-frequency hearing loss in both ears. So what's happening here is that we were born with normal hearing, right? So at some point, all of these X's and O's were in the normal hearing range up around 20 to 25 dB. Now that this patient has this high-pitched hearing loss in both ears, their brain says, what happened to all of my high pitches? I want to still be able to hear all of those high pitches that I heard when I was around 20 years old. So the brain creates its own stimulation. That is why you cannot just look at someone and see their tinnitus. That is why you cannot get really close to someone's ears and hear their tinnitus, because it is being generated by the brain and not by the ear itself. So that is why deaf people have tinnitus, correct? Because they still have brains, right? That is also why, though, there is no cure, okay? So you cannot kill off those areas of the brain without causing worse issues than the tinnitus itself. So have you ever heard the phrase, if you don't use it, you lose it? That is completely true with the neurons that we have in our brain. So the auditory areas of the brain are not having stimulation anymore when we have hearing loss. And another part of the brain does not want those cells or those neurons to die off. Because like when we look at in this example, the previous audiogram, in here, we have hair cells which we are using in low pitches. We have hair cells which we are using in mid pitches as well. So when we look at the high pitches, we have the cells which we are not using. So the brain says, well, I don't want those high-pitched neurons or those high-pitched cells to die off. So let me create my own high-pitched stimulation in order to keep those cells alive. That is why people with tinnitus usually match the pitch of their tinnitus within their hearing loss, because that's our brain trying to keep those high-pitched cells alive. Which sounds great, right? Keeping cells alive in our brain sounds great. But why it creates a really annoying sound to us that we hate it? So we are taught from a very young age that constant high-pitched sounds are actually alarms. Fire alarm, that's a constant high-pitched sound. Police sirens, ambulance sirens, those are constant high-pitched sounds. So there's another part of the brain, it's called the amygdala. It's a very primitive part of the brain. It's responsible from emotional responses. And it's hearing the sound and it says, oh, hey, that's similar to a fire alarm. That's similar to a police siren. That must be alarm. Something must be wrong. I'm gonna go into fight or flight mode. That's why we hate our tinnitus so much, because it triggers another part of our brain to go into fight or flight mode. So what happens in here is that when we hear our tinnitus, that high-pitched ringing or a different form of tinnitus, our brains say, oh, this is a threat, sound the alarm. And as a human being, we tend to feel anxious to sounds that are unfamiliar to us, they are unknown to us, and we feel anxious. So what is our response to this unknown sound? So we resist the tinnitus sound because we don't know the sound, we freak out, we feel uncomfortable, and we feel stressed about it, and then we resist the tinnitus. And this resistance actually blocks habituation, which means it is blocking us from getting better. And then we trap into this cycle. We hear tinnitus, our brain says, oh, go into fight or flight mode because it's a threat, sound the alarm, and then we feel anxious, and then we resist the tinnitus. It blocks us from getting better, and we keep repeating this cycle again and again. If you want to see it from this bigger picture, you will see this cycle. First, you experience the tinnitus, you feel anxious, and then your response is tinnitus resistance. When you resist your tinnitus, you cannot get better because your brain cannot habituate, cannot ignore the tinnitus, and when you have tinnitus, you are trapped in this cycle. Before breaking that cycle, let's talk about what factors affecting tinnitus perception. So when a patient comes to our office as an audiologist, we ask about their anxiety, their stress, their sleep, and their caffeine consumption. So stress and anxiety are related to tinnitus because when our body is producing those stress hormones, our brain goes into fight or flight mode easier. So when we are stressed, we are noticing our tinnitus more. Another factor that affects our tinnitus is the lack of sleep or fatigue. So when we are tired, our brain goes into fight or flight mode easier. So when we are tired, we are going to notice our tinnitus more. And the other thing that I mentioned is caffeine, the other factor. Caffeine is a stimulant, so it helps our brain focus on details, right? But then it helps our brain focus on the tinnitus. So for some people, this is the cycle that they need to break. I'll quickly interrupt here. Please, if you like this video, give it a thumbs up and subscribe to my channel if you like to see more videos like this. So as an audiologist, what we do about tinnitus that caused by a hearing loss? So we help our patients break the association between tinnitus and fight or flight mode. So how we do this? So this whole process that we help our patients to break that tinnitus cycle is called as habituation. There are two ways that we help our patients to habituate. So the first one is sound therapy. It's free. I'm going to explain with more details in the next slides. The second option is hearing aids. Let's talk about sound therapy first. So as I mentioned, this is a free option. There are many customizable options for these apps. So there are many free apps. You can go into Play Store for Android or App Store for iPhone and type in tinnitus masking sounds or tinnitus relief or tinnitus to find many options. Most of the apps are free or they have free version and they have a lot of customizable options. Alright, let's talk about how you can use these sound therapies appropriately. So the idea is to find a sound that is relaxing and pleasing to you. It could be white noise, rain sounds, ocean waves, a bubbling creek, wind chimes, whatever you find relaxing and pleasing to you. I'm going to be repeating this multiple times because it is very important that the sound that you find is pleasing and relaxing to you, because otherwise it is not going to help with your tinnitus. So listen to this sound, the sound that you found relaxing and pleasing whenever your tinnitus is most bothersome. This could be when you are trying to sleep, home alone, or first waking up in the morning. You can use the speaker function on your phone, headphones, or earbuds whenever you feel like you need to use them. Some patients mistakenly set the sound volume too high, thinking that they would mask tinnitus completely, but that doesn't help with habituation. The volume of the masking sound should be slightly below than your tinnitus. The goal is to replace the negative emotional response to tinnitus with positive, relaxing sounds. Eventually, your brain habituates, meaning it pushes the tinnitus into the background. This is a process that can take weeks or months. Once habituation occurs, you gradually lower the volume of the masking sound until you no longer need it. This is similar to Pavlov's dog retraining the brain to focus away from tinnitus. That is option number 1. Let's talk about number 2. So option number 2 is more effective: hearing aids. Hearing aids are custom programmed for each individual's hearing loss. For 99% of my patients with tinnitus, properly programmed hearing aids greatly reduce or eliminate their perception of tinnitus. If hearing loss is causing the tinnitus, managing the hearing loss often reduces the tinnitus. Hearing aids are not a cure though, because tinnitus can return when the hearing aids are removed. It is like glasses. When you take them off, your vision is blurry again. Hearing aids are a great way to manage tinnitus during the day, though you don't sleep in them. When you wear hearing aids for 8 to 10 hours a day, the brain receives stimulation and tinnitus is often reduced enough at night for patients to fall asleep. Hearing aids also have built-in sound generators, playing white noise or other sounds directly into your ear so no one else can hear it rather than you. This solves the logistical issues of using phone apps, especially in social or work situations. So, with the headphones or earbuds, it wouldn't be professional to wear them in work environments. Or if you walk in the street, it wouldn't be safe to wear them because if there is a car coming close to you, you wouldn't be able to hear them while listening your sound therapy from your headphones or earbuds. However, with the hearing aids, you can still hear what's happening around you, so it would be safe and also it will be professional as well because you can wear hearing aids at work. It wouldn't be unprofessional to wear them. So unlike headphones or earbuds, hearing aids keep your ears open and maintain environmental awareness, improving your safety. With the hearing aids also, while you're hearing sounds coming around you, you can still listen those white noise or nature sounds, the sound therapies that you want to listen from your hearing aids, so it wouldn't cause any safety concerns. Thank you so much for watching my video. I hope you were able to learn some management strategies to help with your tinnitus. If you like this video, please give it a thumbs up and don't forget to subscribe if you want to see more videos like this. I will see you in the next video.